Welcome to Dental Unscripted. Where Mike Dinsio and Paula Quinn break down the practice ownership journey, one episode at a time. Starting up, buying, and running a successful dental practice.
What up, guys? Welcome back. This is another episode of Dental Unscripted. We are on a podcast marathon today. I don't know if you guys have been following us live or not, but we are live on Facebook, Instagram, all the things, even LinkedIn, YouTube. So if you guys do follow those channels, you can actually watch these live. We do a little light editing behind the scenes. So if you want to see us screw up and laugh and like maybe flip each other off, I'm joking, then you want to join us live. But we are on Dental Unscripted right now. And just a little housekeeping. We are I'm sick of hearing myself talk here, but we're merging all of our podcasts into one brand, one look, one podcast. So if you've been following us on Startup Unscripted and Dental Acquisition Unscripted, we are now pulling all those into one brand called simply Dental Unscripted. So if you're a big podcaster, I want you to search that. It might be hard to find because it's newer and there's not a bunch of episodes, but moving forward, everything's going to be on there. And the idea here is for more practice management tips, not just startup tips and buying tips, but how to buy a practice. And today is actually all about practice management. And I'm lucky to have my co-host, Miss Paula Quinn, on the show. Hey, Paula, what's going on?
Hey.
So we are doing this thing, and it's me and you, and we got to entertain ourselves. And today's topic is all about like what you don't know. You know, what don't you know? What that looks like, what that feels like when you take over buying a practice, and it's a lot. It's a lot, and you deal with a lot of our clients post-close. You know, I have the benefit of helping all of our clients buy the right practice, find the right practice, evaluate the right practice. And then they get the keys and they're yours. Is that right?
Yes. And then the fun begins, sure.
Then the fun begins. So, so what kind of things, like, we could kind of take this in any direction, but like, what are some of the things that you're thinking of the top of your head about like what that day one looks like? Cause you got all that preparation. And then boom, you own.
Yes. It's all yours. I think probably the thing I learned the hard way, by owning my own was, I mean, I wouldn't see patients the first couple of days. I really would.
Yeah.
Yeah. I mean, I would request that it either be really light, if you have to see hygiene, because I know sometimes that's hard to reschedule 8 or 16 hygiene patients. But you as the doctor, I probably would try to keep the restorative off your schedule the first few days.
How would they do that though? Sorry to interrupt you. How would they do that? Would you tell the broker?
I guess you would just tell, I mean, you would tell the broker. Obviously, you eventually meet the seller, and I hate to lie, but you could say, hey, look, I've got some admin stuff to do, or I'm going to spend part of the day at home or whatever. I'd just like to take these 2 days for some catch up. I mean, at this point, they, every once in a while they've even met the seller and team, it kind of depends, usually not, but I would just, the doc knows, approximately when, or there could be some rescheduling that happens, it's not the end of the world. Again, doctor schedule looks a little bit different than hygiene. It's a little bit easier to reschedule some of that stuff. Like I said, within reason. If it's, if you're scheduled so tight out a month and there's no way, like, I totally get it, but your head space already is not going to be in the position to really do your best dentistry on those couple of days, because you're going to be thinking about team and even the electric bill and what lab and how do I switch all these accounts over? And, it just doesn't get slower from there, right? If you're booked now, if you're only booked out 2 days and then maybe, Thursday and Friday aren't booked, I would just move those patients over, or you could see Monday, Tuesday, and then focus on that stuff the latter part of the week. I'm just thinking the first thing most dentists want to get in is just check some things off their list, right? And you can't when your head's in somebody's mouth all day. You can't. And you can't even pay attention to the team, see what vibe is happening. You don't even get to hear what they're saying to patients. And that's super important. So, I kind of want to start there with, usually you're meeting the team just prior. It could be the night of the keys. It could be the next day. It could be a little bit
2
in
weeks
advance.
before. Yeah. 2
Yeah,
weeks before.
it really just depends. But, I think the number one thing is addressing the team and, just assuring them that you don't have to have all the answers, doctors. I wouldn't expect you to. And quite frankly, if you do, you might be, what's some expressions that aren't horrible, like shooting yourself in the foot, because you just don't know yet. And I wouldn't want you promising or making decisions without literally stepping in the practice. So my response would always be like, hey, especially when it comes to the HR manual, the hours, the name of the practice. Hey guys and gals, we're going to try and keep things the same as much as possible. My goal is to make very little changes. As you know, I haven't owned it. I haven't even, started yet. So if you can just give me a few weeks in there to figure out what does that HR manual look like, what are our true hours? What does the schedule look like? Does it support our hours? Once I've got a little handle on it, we're going to discuss all these things.
Yeah.
Because you want to reassure them, but you don't want to make promises because you just don't know what you don't know. And your intentions are to keep things the same. But what if you get in there and we're working 5 days a week, 8 to 5, and our schedule supports 3 days a week? I wouldn't want to promise any hours. So usually team is worried about, are our benefits staying the same? Is my pay staying the same? Are our hours staying the same? Do I even have a job?
Right.
So, we want to reassure them that, it's going to be business as usual.
Yeah.
For now.
Yeah.
And my goal is to change as little as possible. My intentions are to keep things business as usual. However, if you could give me 3 to 4 weeks in the office, we can address, anything that could potentially be a challenge.
No, I like what you're saying there, Paula, because like there's so many books, podcasts like this one, all kinds of like brokers, like there's just so much information out there, and everybody says don't change anything, don't change anything, and that's pretty much true. But when there are foundational problems, like collecting over the counter, like clinical notes, I don't know, just stuff like foundation risk issues, you have to be able to change some stuff.
You have to.
Your verbal skills were perfect because you're like, hey guys, my intentions are to keep everything the same, and hey, give me a minute, but for right now, business as usual. Like words like that, where it gives you an opportunity to change something if you had to, but it also gives the team something to rely on, a foundation to rely on, right? Like that's kind of what you're saying there. Yeah.
Yeah. I mean, we've even had instances, this is a little off the subject, on the subject, where you buy a practice and it's, Dr. Paula Quinn's practice. Now, you don't have to change it day one, but you might change that name a little bit quicker than you're going to change, Quinn, it's a city, Phoenix dental office.
Phoenix
you know
Dental
what I mean?
Solutions.
Yeah. Because you just don't want the patient to be confused. I think that if it's not going to cause harm, it's not going to cause confusion. it's okay. And it is all in the verbal skills, right? Because even if it's, Dr. Paula Quinn's practice, as a team, it's easy to say, yeah, we are going to change it. The community really knows Dr. Paula Quinn. We just don't want to change too quickly. We don't want to scare people. So we're letting the doctor get settled. And right now, Paula's still visiting, keeping her name attached to the practice. But eventually we will change those things. I don't think there's anything. But as you did say, Michael, there are risk things like, if I'm a dentist that believes in consent forms and I want to protect myself, I may need to implement consent forms. I may need to change my clinical templates because they aren't protective enough for me. It could even be in sterilization. Like you said, over the counter, there are many existing practices that are seasoned that we have let patients continually over the years walk out the door without paying their estimated portion. So those are foundational things that we would definitely want to not have, just because me as a veteran decided to let my patients walk out the door and then I spend thousands of dollars in stamps or whatever, sending out statements. If I am the new doc, I've got, not only do I have the loan of the practice, the building, but I've also got probably my dental loan, my school loan, so I've got a little bit more debt than a seasoned dentist, a veteran dentist. So getting my money immediately is a little bit more important than someone that's been trucking along. Not to mention, like where we are in our lives. If I'm a family of, I've got 2 little ones and veteran doctor, their kids are all grown, I also have less to take care of. So what my financial status looks like versus theirs, what they need is completely different. So 100%, some of those things can be detrimental if not changed immediately. But majority of it, we want to try and keep going as it is.
Yeah, sure. Like kind of taking it back to like the HR stuff. I could only like think of like a few things over the last 5 years of doing these transitions of like nightmare situations with team. I'd say 95% of the time you go in, you put a smile on your face, you give them some cookies, whatever, and you tell them nothing's changing, guys.
Cookies at dental offices, though.
Got it, exactly.
No, I'm just kidding.
Yeah, just food. Just get them some food, and they'll be happy and smile. What you don't want to do is like give them some like grandiose vision day one that you're going to make it a multi-practice type situation, like scaring the crap out of them, but just, try to be sweet, charming, and non-confrontational. Now, and that'll work out just great. But we absolutely have had situations where team members are like, hey, I need a front office person just did the other day. Hey, I need a $7 raise. Hygienist is like, hey, what are you going to do for me? And those absolutely situations come up very, very rarely, but they do happen. They do happen.
I think that when you're doing your due diligence, though, and you're looking at team wages, which are usually something that we ask for, I mean, I would get familiar with industry standards in your area. And if your hygienist is making $40 an hour and you live in Washington and the going rate there is at least 60, right? If not
65, 70.
You're going to get hit. And you need to prepare for that. So when you purchase this practice, honestly, I would honestly coach my doctors that be prepared, and if it doesn't happen, great, right? Like we don't have to worry about it, but be prepared because it's, when you're in an existing job and you've been there for 5, 10, 15 years, you're not making as much as these new people out looking for jobs. They like where they're working. It's probably close to home, or they know the patients. They don't have a real opportunity with the existing doctor that they've been with for years to ask for that big of a raise. Where now this is almost like I'm looking for a new job. I'm going to level out industry standards for myself.
How would you handle? Go ahead. Oh. I was,
Well, I was
I
gonna
was
say,
just gonna
plus
say,
new doc
yeah,
needs me, right? Because they don't want to
yeah.
change, so they're gonna say no.
There's some
Now,
leverage. Yeah,
yeah,
there's
it's a
leverage
leverage.
now.
It's a
Yeah.
leverage. Yeah.
How do you handle
So
that?
yeah, so a couple things. I mean, it depends on who they are. Again, my advice would be the same. Hey, hygienist, hey, front office, I can appreciate that you want to raise. I hear you. If you could give me a few weeks as in ownership, let's revisit this. As a matter of fact, let's put this on the calendar to
Mm,
revisit 30 days from now. I don't know you, you don't know me. I don't even know how this performance is, because so many people ask for raises based on tenure. And
mhm.
yes, organically, the world, we do increase wages over the years,
Yeah,
but it's also about performance. If you're not doing something different than you've always been doing, why do you need this raise? Now, I wouldn't, recommend a new
say it
doc
that way.
saying
Yeah,
that, but what
right.
I would like you to do is have 30 days to revisit, because maybe you don't want front office. Maybe
Mhm.
you find pitfalls in her. And again, not to fire her, but to say, hey, Mary Jo, Nancy Jo was our last one. We'll call him Nancy Jo. That was our earlier front office. Hey, Nancy Jo, I appreciate you. I don't want you going anywhere. If you could give me some time, and in that 30 days, you discover she's never collected over the counter. It's
Yeah,
a great time to say, I'd love to give you that raise. Here are some benchmarks I'd like to put in place. Let's now revisit this in another 30 days. If we can start collecting over the counter, getting statements out weekly, and I can see these ARs go down a little bit or whatever, I'm just making up stuff,
yeah.
then 100% I'm down with giving you a raise, because now you have some leverage on them as well.
I was just gonna say, because they have all the leverage in what you're doing there, which I love, is creating some leverage for yourself because you have no
Yeah.
idea what you're
Well, we
doing,
go
like
in
what
fear
they're
based, right? We're new owners. We think, the 800 active patients are going to leave us if Nancy Jo quits. There's so many fears that in that
yeah,
I don't know that you're going to be 100% comfortable in 30 days, but you're going to feel a lot better than you do day one. Your
yeah,
head's going to be a little bit more on straight. Like I said, you're going to have a little bit more leverage. There's going to be some things that you might be able to discuss and not just be so quick to do whatever you have to do.
yeah.
Now, if they're walking out the door, if you don't give them $10 more an hour,
That's
maybe you give
might be
it
a
to them
different
and then
story.
you
Yeah.
figure out plan B, put an ad in.
Yeah. No, I'm floored by those situations. Those are never employees I want to keep is giving
Exactly.
ultimatums. That's not the kind of person that I would want
That's why I
to work
say
for me.
just do it and worry about it, do plan B,
I
because
love
it's
that. I love that last point on that, and it's what you just said. I'll just say in a different way is like everybody like thinks that you etch things in stone when you make a decision. No, I can give somebody a raise for $7 today, but they're going to be employed for 30 days. I'm going to fire them. Like it's easy. You just put some performance plans in place,
and
write them up 2 times and they're gone. So like you can use people because they're using you in that moment. they're they're using you as an employer, a job. That's what they're using you for. That's why they're asking you for $7 right out of the gate. They're using you for a job. So we
but
can
I would
use
just
them.
remember, if you say yes, what I would do in that is, like you said, let's put in a performance plan. Yes, Paula, I will give you the raise. However, we're going to do a 30, 60, 90-day evaluation, and we're
Yes.
going to see if this is going to work out. And
Yeah.
then that's when you put expectations on them. You
Hmm.
meet them at 30 days. Like Michael mentioned, you write them up for anything. They're late, they don't show up. Now you protect yourself. And maybe that 30 days works out and they're really truly worth that. Then
Yeah.
no harm. You keep them and move forward, but you've got some documentation.
I love it. I love it. Let's pivot. Let's pivot to the patients
Okay.
because I'm thinking like, okay, employees are number one. Let's get them on board. Let's get them buying into what we're doing here. Get them to trust us a little bit. because if you can get them to sell you, that's the best case, right? So your first mission day one is get the employees to get behind you. You might not keep them all, but get them all behind you, and then they can help you with the patients. But like now I'm thinking about patients. So a lot of times what practices send letters, sometimes they don't. Patient comes in. You remember your first day, Paula? Like with the patients, it was probably crazy. I don't know if you remember that, or you're trying to forget those days.
Yeah, because I did not send a letter, or they did not, I should say.
And that was actually good for you. That was good for your situation. We get that question a lot. Like, what do I say? Do I answer the phone, Dr. Jerry Smith and new buyer? Like, I'm just imagining all kinds of scenarios with patients walking in being blindsided, or front office people not sure how to say that. Do you ever get that question?
Yeah, and I would say, the first 6 months are the most critical. As we say, if we can do at least a cycle of patients meeting the doc, that's ideal. Once they meet you, they love you usually, and it kind of just goes from there. So it's those conversations for your quote unquote first 6 months of new patients for you. A true new patient, no biggie, right? They don't know. But your continuing care patients. And I think the more enthusiastic and the more positive and just normalcy that your team members have when talking about the new person, the better it's going to be, because they're reading your vibe, they're reading your confusion, they're reading your doubt. If you're questioning it, they're questioning it. So, usually my recommendation is, Dr. A, who's been there 20, 10, 20, 30 years, has goodwill. And I think it's Dr. A is retiring, or whatever, reason the doctor decides to share that they're leaving. He or she has vetted quite a few dentists, several dentists, and really wanted to find someone that aligned with their philosophy, not only in patient care, but in team care. And they really wanted someone that had the same mentality when it comes to their team and their patients as they did. And they handpicked Dr. Smith. And we think he or she is going to be a great fit. The patients that have met him, and you can do that after patient number one, have loved them. They're really excited. Or whatever. We've talked to patients on their phone. They're really excited to meet them. We'd love for you to give them a try if they're putting you in a doubt. If they're not, you just move forward as normal and you do the introduction, when they come in. But again, I think it's, seller, handpicked, buyer, same philosophies, both patient care and team.
Yeah.
And we're really excited. The patients who have met them are really excited. We'd love for you to give us a try. If there's any pushback, for me, it's, if for me, it would be, oh, Dr. Smith was really concerned you might feel that way. He wanted me to make sure that you knew that Dr. B is going to take great care of you.
Yeah. I love those verbal skills. That's what that does. Like, we're getting a little bit of Paula Quinn now, guys. Here she is. The Quinnisms, the verbal skills are key, guys. Like, I think that like anything in your now practice is like there's going to be so many challenges in your career with business and whatever, but everything comes down to communication, how you communicate with your team, how you communicate to the patients. Every challenge is met with an opportunity, and there absolutely will be frustrated patients, but how you address them and how you make them feel is key.
Yeah. Well, and I think a lot of it comes from the seller, or that day the seller introduces the buyer. And I think as a buyer, that's what I would ask of the seller is, make this the most positive experience that you can when you're introducing me to your team, because that message you give to your team is the message the team's going to give to the patients. And, it's usually a shocker, when not always, when the seller decides to sell. And Sometimes we have tears and sometimes we have excitement. They're ready for a change. But
Yeah.
those ones with tears, I think it's up to the seller to take that team member by the hand and say, this isn't about you. This is about me needing to retire or move on, and trust that unfortunately this is the way it goes. We find out last minute, and it's for the protection of everybody. And we never would have, if we could have shared ahead of time, you would have been one team member that I would have shared with, because I think team members take it personally. Like, I have a close relationship with this doctor. Why wouldn't they have at least told me, especially front office? They're also very territorial with their area. They get worried about those changes. So
Yeah. Yeah.
it just has to be a positive message, both in the letter, if there is a letter, definitely in the messaging, and when the patient comes in. I don't know if that
No,
covers
that
it all.
nailed it. That nailed it. I think that's perfect. It's all about optimism and selling, which is why you probably want to like sell yourself a little bit to the team. Don't go in insecure or mousy is maybe an adjective that you would use, but just like,
But also
hey,
not arrogant either.
oh, not arrogant. Yeah, yeah. No, there is no, I'm glad you said that, because there's a fine line between arrogance and confident. And I think confidence is the key. Be charming, but confident, and don't go in worried about like bragging about yourself, but also don't like have a little awareness here, folks. Like, don't just remember. Oh yeah. I'm thinking of one client like maybe 5 years ago, and I was there the day he met the team. And the dude stood up there for an hour just talking about himself and his credentials and his vision for creating this amazing practice and changing the name and this and that. And by the end, I think one of the dental assistants started crying, and it was just like, oh, and I wanted to like break it up. I actually tried to break it up a couple of times, but he had no awareness that everybody was just kind of like done with it. So you just have to have some awareness, right? But if you have an opportunity, give them maybe your resume. You do want to give them some pitch points. So, doctor went to University of Michigan. I don't know if you know that. I'm just naming a name. University of Michigan's a fantastic dental school. Like you said, seller handpicked all the good stuff. So I think that's great. The average drive time is 25 minutes. So I know we're getting towards the end of this episode, and there's just so much to cover about day one. But I'm also thinking about like clinical. We've got a lot of clinical, obviously, people listening. They're all very detailed. They want to know what they're going to get into and what that looks like. And I have to imagine if they couldn't lighten the schedule, like you suggested in the beginning of this episode, and they're walking into a schedule, man, that's got to be hard with the handoffs and even treatment presentation. I mean, I'm kind of putting you on the spot. There's got a lot of stuff here probably that they're probably thinking about.
Well, I mean, I mean, the two biggest things that stand out clinically to me, and I would say, again, do your due diligence during the due diligence phase, is like, look, how long does that doctor take for a crown prep? And, even if you think you're Speedy Gonzalez and you can do a crown prep in and out in 40 minutes, if he or she's doing them in 2 hours or 90 minutes, leave it, because you're going to want to get to know the patient. You've never worked with the dental assistant, the material, the equipment. So just let it ride. Let the team do what the team's been doing. Now, on the other hand, if you need more time because doc does it in an hour and you like 90 or 2 hours, you are probably going to want to change those and rearrange the schedule a little bit, because you just don't want patient experience to be bad on the first day. Not only, again, are you meeting them and getting to talk to them, but you're also clinically slower. And now you've got a backup, and they're thinking, oh, great, here's, more of your team, probably even the patients, are like, oh, great, he does this or she does this. And they're going to be frustrated with you, because if they're used to going home at 5:10 and you make them stay till 6:00, they're going to hate your guts, So you got to be aware of those kind of things too. You got to take care of patient experience and team. Again, get to know That's why it'd be great if you could have a little time as who does present that treatment. How does the treatment plan presentation go? You're probably going to be, especially during the hygiene visits, you may look in that patient's mouth and be like, I'd be doing a crown here, not a filling, right? Like
Yeah.
this isn't
I
what
could,
I would diagnose. So these are all new patients. And you're, again, I hate to keep saying your team's going to hate you, but your hygienist is going to hate you if you're in her chair for longer than 5-ish minutes. So, you could think about lightening the load. And if you have the opportunity to move those patients for a more comprehensive exam, I hate to bring them back, or you do what you can in the normal amount of time. But I think that you've got to think about that, because 1 hour for a continuing care patient that you've never met, and then I have my job to do with, radiographs and my normal thing, we're not going to mesh very well day one. So
yeah.
make sure that you're thinking about that ahead of time, which is why a lighter schedule or just a hygiene schedule would be nice for the first few days, so you can get some kind of cadence.
I love that. I think that's huge, because I've heard from our clients many, many times from the team, oh my gosh, we're running so far over. He or she's just talking so much. And that makes sense, because a new
And they're like,
patient,
but they're new patients. Yeah.
yeah, an hour and a half. Like I usually get an hour and a half. And
There's a difference between temping. I can walk in if I'm a temp doctor, I can walk in and do exam, but you're looking at this, you're doing a comprehensive exam on these patients. As a matter of fact, you can code it out as a comprehensive exam.
That's true.
Majority of the time. There's some caveats there, but most likely, and there could be, you may be a doctor that likes to phase, so now you want to give 3 options for that tooth that doctor recommended a bridge on. You may be looking at implant. There's things that you may want to do totally different. So it can just be time consuming. You're absolutely right. Usually the first 6 months, we hear that a lot about how the exams are, and they should be. So you got to figure that out.
Yeah. So for the new buyer walking in thinking, oh my God, money, 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 because that's what they're thinking. They're thinking, I got $1 million loan now. That there's the AR cash flow crunch, which we can talk about in other episodes, and how the fluctuation of cash flow in the first 60 days is quite stressful. Whether you buy the ARs or you're getting working capital, it is stressful. So you're worried about money. You're also worried about the team. You're worried about the patients, trying to impart on them. There's a lot going on there, but the big picture, as we kind of get to the finish line of this episode, is that just chill, let it ride, take some time, right?
There's all these issues, but just relax.
Chill. Right. I mean, but it's true though. That's the big picture. The big picture.
Yeah, I think that's probably the best advice you can give. Besides your student loans, you buy a practice that supports, well, there's 2 things, the billing up front. You buy a practice that supports this practice and the way it's running today. So as long as you don't go out buying new technology and investing in big things, what you bring in should support what you just bought. So don't feel like, especially in the first 30 days, that you have to make all these changes. Again, I think the most important thing is, Michael said, I've said, is patient experience and team experience, or, onboarding. And so if you take care of those 2, your billing might be a train wreck up front, which definitely is going to affect you financially, because you've got the credentialing, if we're not collecting over the counter, we do have to address all that, but it doesn't have to affect working hours, patient care. That can all still just be business as usual.
Yeah, I love that. One thing I wanted to touch on, which we're not going to have time here, is like, now you're a business owner, and what are some of those key things that you should probably be tracking from day one? I'm thinking like, what reports and how to close the day out. I don't see young business owners taking that very seriously until they're like 8 months into the practice. They're like, gosh, I'm 8 months in and I haven't even pulled a report. Like, we always challenge our clients to really like be an owner day one. So just because you're kind of putting that face on and trying to chill and be cool, have good vibes and make the patient experience great and make the team trust you, and you're doing all that, that doesn't mean that you're chill with being a business owner. You got to run your business and you got to pay attention to kind of what's going on. So stay tuned on future episodes on what, end of day reporting should be like and how to run your business literally from day one. So last minute comments to shut this down, Paula, so people can get on with their day.
Yeah. I mean, my last bit of advice is the day of just being a dentist is gone. It's gone. You're not the dentist on the corner in the little small town anymore. Like Michael said, you are now a business owner, and things are done over a lot differently now. So not only are you an HR manager, a dental clinician, and you're a business owner, and there's a lot that comes with it. So to sit back and I hope there's no Nancy Joe out there that we're insulting.
Let's just use
that name today. Just having that Nancy Joe run your business, it doesn't exist anymore. You've got to be in the nitty gritty. Like Michael said, we'll get into the front of the house later, but knowing what reports to run, knowing how to read them, understanding your business is the best thing you can do for yourself, because in today's world, those loyal, not saying that those front office people out there aren't loyal and that you can't find one, but it's a me world. People are jumping jobs a lot quicker. It's just a different world. And I would suggest take care of yourself. Take care of yourself as if nobody's coming in tomorrow. And if you do that, it'll just be that much pleasurable when everybody shows up.
I love that. I think that's just so on point, because the Nancy Joes, just as a reminder that they're making $20 to maybe $40 an hour. That would be a lot, but let's just say like high 20s, low 30s is probably the national average. Would you have someone that makes $35 an hour run your whole company? I know I wouldn't. I'm not saying that's, down on them. I'm just simply saying to pass $1 million business off to someone that's making $20, $30 an hour. It's not smart. So know your business. We'll get into that. So again, guys, just a reminder, please, Dental Unscripted, subscribe, like, follow, comment, even join us live. We're having fun. We're giving you guys tips, and reach out if you're interested in getting to know me or Paula on a more personal level and with your business. And so we'd love to help. We do a lot of these transitions. We help a lot of doctors that are just trying to get from 1 million to 2 million. It doesn't have to be a transition or a startup. So we got a team of 10 folks that love and are super passionate about what they do. And so anyways, we have that to share. All right. Without further ado, let's shut this down and complete our next episode. Guys, stay tuned for more stuff. See you, Paula.
All right. Bye.
Thanks for listening. Let us know how you like the show. Rate us on Apple and Spotify. Subscribe and follow for more.